Hello, welcome to the presentation of our group. The country that our group will talk about is Pakistan. My name is Siri. I will mainly talk about the latest healthy indicator of Pakistan. We summarize the latest healthy indicator for Pakistan healthy in 2020, which is nationally representative. So for the first page, in 2020, the millennial mortality rate is about 40%, and about 54% of children die before the age of 1. The mortality rate of children under the age of 5 is about 65%. It can be seen that with the increasing age of children in Pakistan, the mortality rate of children is also gradually increasing. Next page, please. Next, we can see the second page. We can note that as the 2020, the vaccination rate of children in Pakistan is the objective, but the treatment coverage rate of HIV patients in Pakistan is really low. And the family healthy report in Pakistan is only less than 5%. This data can prove where the focus of Pakistan medical care is. I finished my part.
I'm usually Elena. So global burden of disease is a gap between where we want to be in perfect health and where we actually are. Pakistan, as a lower middle income country, a developing country, has large ABD, poor health status. So Pakistan is facing not aging population, it is facing a double burden of disease on communicable disease like TB, malaria, and hepatitis, and non-communicable disease like diabetes, cancer, and heart disease, which account for 20% of GDP. And a younger population needs safe drinking water, adequate sanitation, complete medical insurance system, and sufficient vaccination. According to WHO, infectious diseases have been the leading cause of mortality and disability in Pakistan for adults. Pakistan has the second highest prevalence rate of hepatitis C in the world, has the highest burden of TB in the world, and is one of the 4 countries which polio is still prevalent. According to UNICEF, in Pakistan, mothers and babies don't have access to quality healthcare, good nutrition, and have huge discrepancies between rural area and urban area, and low health education level on mothers. So 70% of child deaths are caused by 3 preventable conditions: the preterm birth due to premature, the intrapone compilation during labor and delivery, and the infections such as sepsis, meningitis, and pneumonia and malaria, where 20% of child deaths could be prevented with vaccinations. Moving on to next one.
Thank you, Alina. Hello, my name is Billy, and I'm going to talk about 3 main public health issues in Pakistan. The first one is malaria. Malaria is one of the 6 priority communicable diseases according to the World Health Organization, affects around 300,000 Pakistan annually. It killed 50,000 people, which most of them were children under 5 years old. The main source of its spreads, as about 60% of the country's population lives in more malaria endemic regions. The second is coronavirus. The first case of coronavirus in Pakistan was confirmed on 26 February 2020. From then on, a continuous spreading of this disease was observed across the country. Up until today, 1.53 million cases have confirmed in Pakistan and caused 30,000 deaths. It has been observed in several cases that coronavirus patients develop certain additional comorbidities like blood coagulation and fatal attack of blood fungus. The last issue is tuberculosis. According to the WHO, Pakistan was ranked 8th out of the 22 countries in the world that most highly prone to tuberculosis. Pakistan has 510,000 new cases emerging every year, and approximately 50,000 people develop drug resistance because the city is lack of clean water, coupled with the imperfect medical system. Ordinary people lack basic hygiene knowledge and are prone to tuberculosis. And I will leave the presentation to the next member.
Hello, my name is Yushan. The risk of 3 diseases, the first being that malaria is caused by parasites which can be transmitted to people through the bite of an infected mosquito. In severe cases, the mortality rate is extremely high. Multiple malaria episode can lead to miscarriage or even hepatitis. For COVID-19, also the most severe need to face great mortality. Many parents suffer from stroke and hypoglycemia. The last one is the tuberculosis, which is also life-threatening. If tuberculosis is a long-term and extensive disease, it will become difficult to treat it. So next page, please. The main transmission groups of malaria are the following 5 groups. COVID-19 mainly spared the following 3 types of people who share a common feature of low immunity. Tuberculosis is also transmitted to the following 3 types of people, so it is very important to improve immunity. That's our next person, please.
Hi, my name is Zhou Xueli, and I'm in charge of this part, and I'll give recommendations for interventions. First of all, 60% of Pakistan's population live in malaria endemic areas, which means that protection for vulnerable people must be more in place. Enough separate quarantine areas should be built. More medical professionals should be trained in vulnerable areas, and as much medicine as possible should be provided, as well as mosquito nets and large quantities of anti-malarial drugs. Secondly, in the case of the new epidemic, measures should be taken to prevent and control the epidemic as much as possible, to urge the unvaccinated population to be vaccinated, and to support protective tools such as masks and protective clothing. Tuberculosis is also a serious health problem for Pakistan. Because of the poor urban greenery and poor ecosystem, the rate of tuberculosis is the 8th highest in the world. It is imperative to invest in improving urban greenery, building water treatment plants to purify water, reusing sewage, and training more healthcare workers to prevent tuberculosis in advance. Also, the reduction of malnutrition and smoking, which are determinants of tuberculosis, are effective interventions through the collaboration of multiple medical professionals. Okay, so move to the next person.
Hi, my name is Peng Yema. For malaria, coronavirus disease, and tuberculosis in Paris, they should turn interventions in terms of lethality, infectivity numbers, and circumstances. For example, the coronavirus disease is both lethal and contagious to the global human beings, including Pakistan. So it should be the first direction of intervention. Malaria in Pakistan is very contagious and lethal, so it should be followed by intervention. Pakistan has a large number of tuberculosis patients every year, and it is difficult to cure because of drug resistance in some people, and because problems such as the environment and medical level are difficult to solve in the near future. It can be put in the last intervention. I think the best near-term outcome for Pakistan is to effectively control the spread of the virus and reduce the morbidity and mortality of the disease. If these diseases are effectively intervened and addressed, the ultimate beneficiaries will be the entire people of Pakistan. Because malaria and coronavirus disease are both contagious diseases, people may be infected at any time. If there is effective intervention, the possibility of intervention will be greatly reduced. Tuberculosis is associated with environmental problems and medical standards. The primers of reducing the prevalence of tuberculosis is the improvement of medical standards and environmental problems, which will greatly improve people's quality of life. That's all. Thank you for listening.